Thank you so much, Nancy, for that warm welcome. I am very excited to be here. I already feel like I'm amongst friends and colleagues in the field, as well as educators. I was in education as my primary vocation for 14 years before I transitioned over to private practice. So it's nice to be among so many people who are passionate about the work. And so thank you again. I am Neasel Connor, and I am a licensed professional counselor here in the greater Austin area. I have been in private practice for a little bit over 2.5 years. And it has been such a joy to kind of be in this space and work with so many women in this field. We are saying I'm Neasel Connor, and I am a mental health professional here in the greater Austin area. And I'm also owner of Beyond the Happy, which is my private practice as well as my company. I'm also the creator of the Mindset Meets Goals Meets Mental Health Vision Board experiences that we've been able to do with over 3,000 people all over the world with companies like Google and the United States Air Force. And then I'm also the proud facilitator of the Hearts to Hear Perinatal Grief and Loss Group, which is a local nonprofit here in the Austin area. So that's a little bit about me and my background, but I'm really excited to get into the meat of what I want to talk to you all about today. And it's this concept of masking and the burden that it can be to be a strong Black woman. And so here's a little bit about what our roadmap for today will be. So first, we're gonna unpack what does it even mean to be strong. We're gonna define it. I'm a therapist that loves to look at actual definitions of words. And so we will do that while also examining how strength is a burden and also armor for Black women in America. And then we'll talk a little bit about the Superwoman Schema. Then we'll transition and talk about how systems impact the strong narrative and why do Black women need to be strong in the first place and what systems kind of perpetuate that need for strength. And then lastly, we'll talk about considerations for service providers. How can we that are in the field help Black women not always have to be strong? And what can we do to support them and be allies as we think about services that we provide for the community? So that's a little bit about our presentation for today and kind of the path of where we'll be going. At the end, I will leave time for questions. And so if you want to put your questions in the Q&A box or in the chat at the end, I'll be glad to answer all of the questions that come up as a result of this presentation. All right. So I want you to think about the last time you wore a mask or a costume, and I want you to put it in the chat. What did you dress up as? The last time you wore a mask or a costume, what did you dress up as? And you can go ahead and let us know in the chat the last time you wore a mask or a costume and what you dressed up as. Wonder Woman, the Hulk, Pac-Man. Wow, we have lots of costumes going on here. Okay, a football player, Mardi Gras, a flapper. Nice, nice. Thing one, I love a whoopee cushion. How cute. I love these costumes that you all are putting in the chat. Thank you for sharing. Keep them coming. So for me, the last time I dressed up in a costume was a couple of Halloweens ago. My family and I all decided to be M&Ms. And so we all got different color shirts. We had M's on them. My daughter and I, we had on tutus, and we went around dressed as like a family of M&Ms. And from that time, I just remember it being really cute. We got some really cute family photos out of it. But if I'm being honest, I really don't like costumes. Sometimes they can be incredibly uncomfortable to have on for a long amount of time. And I just remember being excited to get home and take that tutu off because it was itchy. and I could finally relax from having the costume on. And I think for a lot of us, we love the idea of dressing up and being able to be characters, depending on the function or the holiday. But what happens when you are not able to take that mask or costume off? And that's kind of what is going to transition us into our talk today, is that sometimes Black women are having to wear a mask that isn't so easy to take off after the event is over or after the party is over. And so we're going to talk about why that happens for Black women and why it's so important for them to have spaces where they can take the mask off. Thank you all for sharing those costumes in the chat with me. I want to open up by reading a little bit of this poem by Paul Laurence Dunbar that talks about we wear the mask. And so it says, we wear the mask that grins and lies. It hides our cheeks and shades our eyes. This debt we pay to human guile. With torn and bleeding hearts we smile. And mouth with myriad subtleties. Why should the world be overwise in counting all our tears and sighs? Nay, let them only see us while we wear the mask. Paul Laurence Dunbar wrote this poem. This was post-Civil War, and he was kind of talking about the experience of African Americans post-Civil War and how a lot of times they were having to show up as wearing a mask because it would be too dangerous or too vulnerable for anybody else to see otherwise, for anybody else to see the struggle or the tears that was really happening behind the mask. And so I wanted to share that because I think the poem is really telling and timely for our discussion today. So why is a mask, a cape, or being strong necessary for Black women? So let's talk about strong and what strength really means for Black women and the Superwoman schema that a lot of Black women are experiencing in America. And so if we just think about general definitions of strength, there are, or strong, there are two that come up in the dictionary. The first one being having great physical power and ability and having a lot of strength. Makes sense. It's pretty common that that's what we attribute to the word strong. But the second definition is what I like the most and what really resonates with me. And it says, not easy to break or damage. Think about that for a minute. Not easy to break or damage. And that is, I think, some of what Black women in America experience is that there's a sense of resiliency that has come as a result of the circumstances that they have had to endure. And so they're not easily broken or damaged. How is strong armor and burden? So one, like I just said, there's resiliency in the face of adversity, right? When we think about all of the things that Black women in America have had to overcome, there's this resiliency that comes along with it. There's this intense motivation to succeed. So if you look at even the climate of entrepreneurship and business, Black women are the leading demographic of new business owners in America. There's this really intense drive to make it that Black women embody. And so that's how strong can sometimes serve as armor. And then also it's a coping strategy, right? It allows us to cope with the stress and the racial discrimination and the microaggressions that we encounter on a daily basis. But strong is also a burden because when you are experiencing chronic stress and chronic discrimination and chronic racism, it impacts your physical body. And so that's how this strong and not letting things break the armor that I'm wearing can hurt me physically. And also it can become very sacrificial, that we are sacrificing our own needs, our own desires, our own want for others. And so, yes, it's appearing as strong, but it's also coming at the cost of ourselves and our livelihood and our health. And it also results in us hiding a lot of the pain that we may be feeling internally, but may not feel safe enough to express. So there's some great work that has been going on in the field, and this Superwoman schema was born out of the research done by Dr. Allen and Dr. Giscombe that talked about what does it mean to be Superwoman for a Black woman, especially in the face of racial discrimination, right? And there are 5 key components to this framework that makes up the Superwoman schema. And so I want to go through what these components look like. So first is feeling an obligation to present an image of strength. So almost like showing up into space and no one being able to detect any weakness or vulnerability within us, right? It's just we're going to appear strong no matter the setting that we are in. There's also a feeling and obligation to suppress emotion, right? So if we are sad, if we are angry, if we are in pain, it's the suppression of the emotion so that nobody knows that we are suffering with anything, and so that they can't tell that we are weak or not able to endure or move up in the company or take all of the stress that comes with the promotion, right? It's this ability to suppress our emotions. These first 2 also point to the fact of how hard it can be for Black women to ask for help, right? If I'm presenting this image of strength, if I am suppressing emotions, then it is going to be really hard for me to ask for help and support, especially if I don't feel safe enough to do so, okay? The third piece of this framework is the resistance to being vulnerable, again, pointing back to not wanting to appear weak or not strong. The fourth component is a drive to succeed despite limited resources. And so again, when I was talking about how does it become armor, it's this, no matter what's thrown at us, we are going to do what is necessary to rise above. How this is a hindrance, though, is that sometimes society will start to think that it's okay for Black women to have less or not be paid the same amount because they're able to do so much with so little, right? And so that's how it can become a burden to us, and how society can sometimes take that and not give Black women all of the resources or all of the support that they need on their journeys. And then the last one is feeling an obligation to help others, even when it comes at the cost of our own welfare. It's this intense need to have to help and support our families and our partners and our coworkers and anyone in our network in order to make sure that we're doing all that we can to help others. What's interesting about this framework and this these components is that the researchers discovered that although some of these pointed to adverse health outcomes, the feeling and obligation to suppress emotions actually helped Black women. And what they discovered is because anger is so detrimental to our physical health, when Black women were able to suppress the anger, they found that that helped a little bit. But what is also important to understand about this is that there aren't safe outlets for Black women to express the anger either, right? And so it's important to know that these components can point to adverse health outcomes, but in some ways can also be protective factors. And so here's a little reflection question for you, and you can put your thoughts in the chat. And I want you to think about this. As you think about the Superwoman schema, how can this inform your work? How can this inform your work if you think about the Black women or the Black adolescents that you work with in the field? How does knowing about this Superwoman schema inform your work? And you can put your thoughts in the chat. How can this inform your work as a practitioner? And I'll put the schema back up for you to reflect on. So feel free to put in the chat, how does this inform our work? To be more empathic. I love that. Yes, absolutely. Thank you for sharing that, Clarissa. Right. I think one of the things that comes up for me and informs my work is that it might be hard for my clients to ask for help. And so I always try to ask them what do they need and then give them like a menu of things that they might need so that they have the language to ask for the help that they need. I love these comments in the chat. It improves our awareness, absolutely. It's okay to not be okay, absolutely. Yes, thank you, Megan, for that. It is difficult to rely on others for help. I think another component of this that I didn't touch on was that this difficulty and asking for help also points to asking for help and being let down, or people not helping in the ways that they said they would. And that kind of reinforces the not asking for help, right? When you've asked for help and you didn't get your needs met. Thank you all for sharing. Keep them coming, keep them coming. I love how you all are thinking through already how this can inform your work. And also knowing that I think someone mentioned in the chat how the Superwoman schema is inherent. And I also want you to know that it starts really young. So although we're talking about Black women, you might discover that this is already showing up in your Black adolescents that you are working with. Some of this schema might already be embedded into how they're navigating their day-to-day lives. Okay. All right. So being strong isn't always by choice. Sometimes it's necessary for survival. And I say that because I don't know if there's anyone who just wants to be strong all the time. And the reasons why it is difficult for Black women to not have to embody this armor of strength is because of the systems that they're navigating. And so we're going to talk through some of the systems that perpetuate the need for strength. So these are some common systems that Black women are navigating. So first, there's education, right? So Black children, are disproportionately disciplined in schools compared to other demographics. So think about this for a minute. So I, as a Black mother with children in public education, have to be mindfully aware that my children have the potential to be disproportionately disciplined than their other classmates. So what does that mean? That means I have to be a strong mama bear, and I have to speak up, and I have to be mindful of how I engage with the school and administration and my children's teachers. I also have to have these tough conversations with my own children because of how they'll have to navigate the education system, right? And so that's one system that perpetuates the need for strength. Then there's work. Okay, Black women experience more microaggressions at work and are underrepresented in leadership positions, and they also earn less. So this means that a lot of Black women are going to work and not seeing leadership that looks like them. And so because of that, they're having to make sure that they show up at work a certain way, that they can't appear to be angry. They have to make sure that they have it all together and that they're kind and that they're nice and that they don't ruffle any feathers, right? Because they don't see themselves reflected a lot in leadership. And so they feel like they have to present a certain way. Also, they have to deal with daily microaggressions like, oh my gosh, you're so articulate, or what did you do with your, what's that thing that you do with your hair? On a daily basis, they're having to navigate these systems and questions at work, okay? Then there's the system of healthcare. Black women are at risk of not receiving necessary medical care due to health concerns not being taken seriously. In my private practice, about 90% of the clients that I serve are Black women. And for my clients that are mothers or are experiencing pregnancy, there have been countless sessions where they've talked about, I feel like this is going on with my body and with the baby, but my doctor's not listening to me. Or I've had clients who've had to switch doctors midway in pregnancies because they felt like they weren't being heard with their current doctor. And we know about the Black maternal mortality rates in America, as well as, there's been research that talks about what medical professionals think about how Black Americans experience pain. And so that's another system that perpetuates strength. Then there's mental health. Black women are less likely to seek mental health care due to lack of access and cultural insensitivity. There are a lot of barriers that Black women are navigating in getting the supportive mental health care that they desire, as well as the field isn't really reflective of them as well. Only 4% of psychologists in America are Black. And so sometimes Black women don't feel seen or heard when they are seeking support for their mental health as well. Other systems, there's the judicial system that perpetuates strength. Black women are less likely to have access to resources to post bond or have adequate defense representation. So other burdens and barriers that Black women are having to navigate in the judicial system. Then there's family, right? I'm at work and I'm wearing the mask, I'm wearing the Superwoman cape, but then I'm coming home and I'm doing it as well. 76% of Black women who work are also mothers and are also disproportionately head of households or the primary income earner in their family. And then there's the system of media and social media, which has images of mainstream beauty standards that are not always reflective of Black beauty as well. And so these are some of the systems that perpetuate the cape that we need to wear, or perpetuate this feeling of I have to show up a certain kind of way in this system in order to get what I need, or I have to show up a certain way in that system to get what I need. And so this makes it hard to take off the mask. It makes it hard to take off the cape when you're just navigating these systems that aren't designed to support you in the ways that you need to be supported. So here's another reflection question for you. I just went over, let's count them, 7 systems, just 7 that Black women are having to navigate with the odds seemingly stacked against them. And so you as a service provider or someone who is in this field, how can your work help disrupt the systems? Because part of wearing the cape and part of being strong is Black women feeling safe enough to take it off. And in order to take it off, sometimes these systems need to be disrupted and changed so that that felt safety can be felt. And so as a service provider, how can your work help disrupt systems? Feel free to to put your response in the chat on how you think your work can help disrupt systems. Okay. It's okay to say no. Yes, helping them understand it's okay to say no. The power of using their voice. Anyone else? Creating safe spaces. Yes, and I think that goes along with even the using the voice, right? Because sometimes using the voice is weaponized against Black women. And so it's providing the safety so that they feel safe enough to use their voice. So thank you for that. I saw boundaries. Ooh, sliding scale. I love like a action item type of disruption. Thank you for sharing that, Nikki. I'm gonna scroll up because I saw something about boundaries. Absolutely help them set boundaries. Educate the systems, right? I think having conversations like this one, I'm so grateful to Gladney for even creating this space for us to even talk about this this afternoon, because you're exactly right. Like, we have to educate the systems and talk about what is really going on. So thank you for sharing that, Latasha. Advocacy. Yes, we do need more advocacy for sure. Advocate. Thank you for sharing that, Stephanie, and your vulnerability as always trying not to be seen as angry. Like, I want you all to understand the mental Olympics that Black women are having to think about when they enter spaces in order not to present as angry, right? It's like, okay, how do I sound passionate? Can't be too loud. Okay, these are words I might have to use. I have to enter the space and be soft and smile a lot and be approachable. All of these things you're having to jump through just to appear not angry. So thank you for sharing that, Stephanie. Encouraging felt safety. Yes, early engagement with the family. Love it. These are really good. And I love that you all are like not just putting something out there, but actually like thinking through like how that can be created. Validating emotional responses to microaggressions. Yes, yes, emphasizing that they are not crazy and calling out racial injustice. Yes, when we get to the part of this presentation, when I talk about what we can do and action steps, it really is us being able to, us as service providers, calling out systems alongside Black women. Black women can't be the only ones doing the heavy lifting when it comes to disrupting systems. We actually have to have people alongside us that are as passionate about disrupting the systems as we are. So thank you. Those are great responses. Thank you all for answering so reflectively as well. All right. So what are some of the health implications for wearing the cape and for being strong and wearing the mask? Well, first there is weathering, and that is this early deterioration that's happening on the insides of our bodies based on repeated exposure to discrimination and socioeconomic adversity and marginalization. And so research has been done that actually showed that Black women's bodies on the inside are deteriorating more quickly than other demographics based on their repeated exposure to discrimination and adversity and marginalization. And that's this concept called weathering. There's also cardiovascular diseases. Black women are disproportionately impacted by stroke, diabetes, and heart disease. One of the things I commonly say is that it doesn't surprise me that Black women suffer from heart disease more than any other demographic because of how many times our hearts have collectively been broken. Just as you watch the news on a day-to-day basis, or as you go to work, or even within your own family, the amount of times that our hearts are emotionally broken because of the systems and because of the injustices and because of the racism and the discrimination that we're having to witness over and over and over again. Then there's the mental health strain, and it's Black women's exposure to chronic stress impacts their mental health. And I think what is scary for me as a clinician is the amount of Black women I see in my practice that are suffering from high functioning depression. So like they're out in the world presenting as happy and successful, but internally are really struggling with their own emotions and their emotional needs. And so there's the mental health strain. And then finally, cancer. Black women have higher mortality rates when diagnosed with breast and cervical cancer. So I put these health implications in this presentation because I think it's important for all of us to understand that this just isn't an idea of Black women wearing a cape and being strong. Like, this is actually physically impacting the health and the well-being of Black women because of this. And I think it's important for us to know the connections between the two. So how can we help? I think this is the most important part of the presentation because it really speaks to like what we can do in this field. And I always like to start with this story. So I'm in full-time private practice, and like I said earlier, 90% of my clients are Black women. And in every consultation, I go over who I am, I go over how long I've been practicing, I go over my practice style, but I always say this, I always say that I'm passionate about making this space, this therapeutic space, a place where you do not have to perform. You do not have to be anybody but yourself. And every time I say that in a consultation, I get one or two responses. Either it's like a deep sigh of relief or tears. And I think it's because there are so few spaces that Black women can go where they can feel safe and feel like they can be exactly who they are without having to perform. And so when we think about how we can help, it's really creating more spaces and more systems for Black women to be exactly who they are without having to perform, without having to be strong, and without having to wear a cape. So what are some of those things that we can do? So here are some considerations for service providers. One, be curious and compassionate. Approach your Black woman clients with curiosity first, right? I think in this field, especially in the mental health field, at times, we can feel like we have to be so prescriptive with our approach that we'll be thinking through solutions without hearing all of our clients' stories. And so it's really centering our clients and really being curious about their lived experiences, about their knowledge, about what they think they need before we bring our solutions and our strategies and our resources. So being curious and compassionate. Second, interrupting and disrupting the systems like we just talked about. A lot of systems that Black women are navigating are oppressive and they're discriminatory and they're racist. And it can't just be, like I said earlier, Black women doing the heavy lifting and putting themselves out there in order to disrupt the systems. What we really need is people that will come alongside Black women and actively advocate and disrupt the systems as much or more so than the Black women have to do in the system. Then there's also creating safe spaces spaces that are free of bias, criticism, judgment, and harm. And I think it's really important that when we are in space with our clients, that we are checking our own biases, we are checking the things that are coming up for us while we're engaging in conversations or engaging in services, and so that we can make sure that we are not making assumptions about our clients while they're in the space, right? And that helps to create a safe space. It lets me know that I can come and be exactly who I am without being criticized, treated unfairly, or judged because of it. I think one of the things that I appreciate about the therapeutic space and working with Black women is Black women in our hair is a really big thing, myself included, right? And so everyone doesn't always understand, like, why do Black women wear bonnets? Why do they wear these things on their head? And it's really to protect our hair. It's to protect our hair. It's to protect our hairstyles. And so when I am in therapeutic practice and I come to a session with one of my clients and they might be wearing a bonnet, the first thing they try to do is apologize. And I say, you don't have to apologize. I completely understand where you're coming from. There's no judgment in this space. You are free to exist exactly who you are, even in the therapeutic room. And so it's creating safe spaces and letting clients show up exactly who they are and like they are, okay? And then secondly, have Black women at the table. So if you are in organizations, or especially if you are in leadership, I really want you to ask yourself or ask the organization, how many Black women do we have at the table when we're making decisions about services and programming, right? Have Black women at the table and also pay them. Pay them for their intellectual property, pay them for their knowledge, pay them for their experience. Don't just take their information and repackage it and then present a program and service. No, I see the hearts and the hand claps. Thank you all. But really, yes, that is part of interrupting the system. It's paying Black women for their emotional and intellectual labor. And so that is how you amplify Black women voices. Also help create pathways to access. I think we are really resource rich, especially in this Austin area. We have a lot of resources to give our clients, but we don't have straightforward pathways to the resources. At times it can feel like there's a lot of gatekeeping, or I can only go here to get what I need. When really, I think how we really support Black women is giving them accessible pathways to the resources, making the processes easier and more streamlined for them to get what they need. If I already struggle with asking for help, if the pathway to the help isn't accessible, that adds another barrier to me getting what I need. So help create pathways to access. And then the last one is just examine your own ideas and beliefs. You know, sit with, examine and question your own personal ideas and your beliefs and how they impact the client relationship. We all have things that we are using as filters to help us navigate the world based off of our experiences. And so part of the work that we have to do as service providers is sit with our filters, sit with the why we navigate the world in the ways that we do based off of our own experiences, and figure out how that impacts the relationships that we have with our clients. Okay, so those are some considerations for us as service providers and things that we can do, like really action item things that we can do to support Black women, especially if we are in the field of providing services and support for them. And so this is our last reflection question that I want you to think about. And out of the considerations, that I listed, which one would you like to adopt or add as a practice? So out of the 7 considerations that I listed, which ones would you like to adopt or add as a practice? And I can go back quickly and show them to you all again as you think through which ones you would like to add to your practice. So we have Black women at the table, help create pathways to access, examine your own ideas and beliefs. And then we also had, what happened? I went all the way to the beginning. Let me catch back up to where we were. As you think through how you can help. And these were the first 3. Be curious and compassionate, disrupt systems, and create safe spaces. So which ones of these would you like to adopt or add to your own practice? Let's see, have Black women at the table. Lots of have Black women at the table, lots of create safe spaces, interrupting and disrupting the systems. I also saw the curious and compassionate. Yes. I love how many of you all agree with having more Black women at the table. Absolutely, absolutely. Streamlined pathways. Yes, pay Black women for their services. Absolutely. Interrupting the system. Yes, I love these. I love that you all are taking them and really intentional about letting this inform your work, because I think that's what's really at the heart of this presentation. It's one thing for me to deliver the information, but change happens when we take what we have learned and we start to do things differently as a result of it. And that is my hope for everything that I have given you all today. So I want to leave time for any final thoughts or questions that I could answer. Are there any thoughts or questions that I can answer for anyone today? You can put them in the chat. You can put them in the Q&A box on your toolbar. But are there any questions that I can answer? I'll give you a few more seconds to think through if there are any questions. Alexis, great question. So how do you apply this information to different generations? So I think something to be mindful of is that there is, like, the research even on the Superwoman schema is fairly new. So part of the work is we need more information about how Black women are navigating the world. And so I think that action step of, like, being curious is really important, dependent upon, it's important no matter who we're working with. But one thing I did want to highlight again is, even when it comes to the Superwoman schema, what the researchers found is that it is starting early in adolescence. And so if you can imagine, there's some of this that is generational, that has been passed down, that has been a part of a culture, that has been witnessed. And so as we think about, like, our grandmothers and our mothers, and then us and our daughters, you can understand how some of these ideas that are within the Superwoman schema have almost been passed down generation to generation and have become a part of the culture. And so even when we think about how we disrupt it, it's also understanding that some of this is cultural as well. And so being curious with your clients, being curious about what their lived experience is, especially if you work with clients that are younger and older, I think will help give you more insight and information into how this shows up in their world. So great question. Thank you. All right. Thank you all for the feedback and for the kind words. I did want to leave you all with some just additional resources if you are curious to learn more about Black women in America, and kind of the lived experience. These are some great resources to read and study. Black Fatigue, How Racism Arose the Mind, Body, and Spirit. We also have The Strong Black Woman and Shifting the Double Lives of Black Women in America, which is one of my personal favorites and is really insightful, and really kind of unpacks the layers to Black women and their lived experiences. All of these resources can be found on Amazon. But I think part of the work is making sure that we learn more, and that the learning doesn't just stop at presentations like these, but we take time to further our understanding and our knowledge by investing in resources that have been created by Black women. And so Black Fatigue, The Strong Black Women and Black Woman, and Shifting are resources that I would recommend. Feel free to take a screenshot of this or take a picture so that you have this for later reference if you want to get these resources. And then if you would like to connect with me additionally, this is my contact information. You can find me at Beyond the Happy on Facebook and Instagram, but you can also reach out to me directly at Neasel at beyondthehappy.com, or you can go to my website, Beyond the Happy, and send me a message. I would love to present this information to your organization, or if you would just like to talk or chat or learn more about anything, feel free to connect with me after this. I would love, love, love to be connected to you.